Very sad that during this tumultuous period, when the whole world, all scientists in the world, all scholars, all government leaders, their minds is focused on fighting COVID-19 to bring it to its knees. Contrary to what the whole world is doing, the Ministry of Health in this country is focused, concerned, and has assembled all her energies to provoking frontline health workers to abandon their duties the way Zimbabwe government did. Zimbabwe is the only country in the world that health workers went on strike on the onset of this pandemic. Kenya is going to be number 2 in the whole world. It is very sad that somebody in the Ministry of Health decides to provoke and touch a fresh wound and spear it with a spear.
Lazima serikali iweze kuangalia haya mambo kwa muda mchache ambao umebaki, ama masiku yale ambayo tumewapatia, kwa sababu tulikuwa tumewapatia masiku na zikaisha. Tumeongezea siku zingine 14 waweze kutekeleza matakwa haya ya kuainisha hili posho la wanaafya kufuatana na ile tunaita health risk allowance. La pili ni promotion ama nyongeza ya cheo katika kazi. Hii tumesema pia lazima ifanywe. Kuna watu wameweza kuhudumu kwa cheo kimoja ama kwa nyadhifa moja kwa miaka zaidi ya 15. Na tukiona ministry wakati huu wamepewa hela ya kuweza kuwasupport health workers na kuwapromote. Selectively wameweza kupromote one cadre na wameacha wengine wote.
By promoting one cadre, even when you look at the statistics of those health workers who have been infected up to today, they will tell you who is on the front line. When you look at the 19 health workers who were put in quarantine in Kenyatta National Hospital, you will know that out of those 19, we have 10 who are nurses. We have 2 doctors, 4 clinical officers. When you go to Mombasa, those 10 through mass testing, those who are found to have COVID-19 infection, they were 10 out of 305. Out of 10, 8 are nurses, 2 are doctors. So, when you go to Ngara, we had clinical officers and doctors and clinical officers and nurses who are infected. And in fact, research has been done all over the country and all over the world. We do not want to repeat what is known, but who are the frontline health workers. We want to beseech the government. We want to beseech the President, His Excellency. We support you. We support your commitment to fighting COVID-19. But we want to tell you that the provocation that has been occasioned by the Ministry of Health.
The Ministry has worked very closely with the Public Service Commission, Salaries and Remuneration Commission, and we have developed a plan which is awaiting approval before it can officially be shared with the healthcare workers.
Teams are looking to see and to ensure that all health cadres are able to get a welfare package that meets the kind of risks that they're putting themselves into.